All right, good afternoon, and thank you for being with us today. We are the Youth Development Institute of Puerto Rico. We are an entity that's dedicated to promoting changes in public policy with a particular focus on reducing child poverty in the island. Today, we are going to be presenting the latest findings from a study that we recently conducted on the impact of COVID-19 on children in Puerto Rico, particularly on the rate of child poverty in the island. We are going to be hearing today from our fantastic research and policy team. We're going to be hearing from Dr. Maria Inchaltegui, who's our Director of Research and Policy, who is one of the authors of the study. She is going to be providing a little bit of a context of where Puerto Rico was and Puerto Rico's children were in the midst of when we got hit by the COVID pandemic. The second person you are going to hear from today is Caridad Arroyo, who is one of the co-authors of the study and policy statistics manager for the Institute. She will talk to you a little bit about those projections of how many children we estimate that have fallen into poverty over the last month and can continue to be falling into poverty as a result of the COVID-19 pandemic. Then you're also going to hear from Brian Rosa, our policy manager. Brian is going to be giving you an overview of where Puerto Rico, and particularly programs that impact children and families and cash transfers, how Puerto Rico fared in the last series of relief packages around COVID. And then I am Amanda Rivera. I'm the Executive Director of the Youth Development Institute. I'm going to be providing an overview of some specific federal policies that can be implemented both in the short and the long term to address the needs of children in Puerto Rico, particularly those living in poverty. And then in the end, we're going to have a space for questions and answers. What I ask you to do is, I know that sometimes questions might emerge as we begin discussing, so if you can write those questions in the Q&A section or in the chat, Ataveira Medina, who is here with us today, will be moderating that piece of the discussion. So as questions come up, you can write them there. I am having a little bit of a technical, here we go, okay, so it's flowing. Okay, so I just wanted, as I said earlier, we are an entity that's dedicated to promoting research and people-driven public policies in Puerto Rico that strengthen the economic security of families, children, and youth, and our focus is the reduction of child poverty in the island. And we have a focus on the reduction of child poverty in Puerto Rico over the next 10 years. We have different ways of doing this. We empower those affected to engage in the policy process. We have a part of our work that is directly with mothers and young people. We promote the use of data and research among policymakers, which is part of what we're doing today. And we also engage in traditional advocacy work as well as grassroots mobilization to move these solutions. So as I said earlier, we're going to start with Dr. Inchaltegui, who's going to give you an overview of the context of Puerto Rico as it received this COVID pandemic. Dr. Inchaltegui.
Good afternoon. As possibly you know, Puerto Rico has experienced about 3 natural disasters in less than 3 years, and we are considering COVID a natural disaster. So we are talking about the Hurricane Maria, the earthquakes early this year, and now the COVID pandemic. This natural phenomena has become a disaster when there is no the infrastructure and the families doesn't have the resources to be able to successfully confront these phenomena. So what is the context that makes Puerto Rico and their families vulnerable to the COVID pandemic and other natural disasters? For the last more than 10 years now, we have had a very weak economy. We haven't grown in the last few years. There has been austerity policies to be able to pay for the more than $70 billion public debt. the population of the general population has been declining, and the child population has been declining even more. There is a general lack of trust in government. Puerto Rico also have a high share of people with health conditions such as diabetes and cardiovascular diseases. And the families confront economic insecurity because of the low levels of unemployment and low wages and unstable employment conditions. There is also food insecurity. A 2015 survey indicated that about 35% of Puerto Rican families has experienced food insecurity. And we also have a problem with the digital divide, in which children that are poor really doesn't have access to computers and internet connection, which is very important for this COVID pandemic, because a lot of the services are being provided, especially education, online. Next. This is the child poverty of Puerto Rico up to the most recent, which is 58%. As you can see, the child poverty of Puerto Rico has been quite stable in the last, basically in the last 20 years. It hasn't moved much. And that is a total of 343,000 children in Puerto Rico that live in poverty. And we are using the federal poverty threshold, which for a family of a mother and 2 children was $20,700 in 2018. We are using the federal poverty threshold to identify children in poverty. As this shows, 6 of every 10 children out of 594 children, 343% of them live in poverty. This is the number of children. In the 1990s, there was over 1 million children in Puerto Rico. By 2019, these figures we just updated yesterday with the new estimates from the census. The population of children has declined a lot. Currently, we only have 572 children as of the estimates of 2018. So the population of children have declined much more than the general population in Puerto Rico, because we know the general population is also declining. So what are the implications of this high child poverty rate for children? What does it mean for adults and for Puerto Rico? We see poverty as through the effect that it creates in limiting the development of children, limiting the capacity and the human potential of children. Children that grew up in poverty experience high school dropouts, poor academic performance, less likely to go to college. They attend poor quality schools. They are more exposed to crime and violence. They have poor health conditions such as asthma, cognitive disability, obesity, and food insecurity. And they are the very same poverty expose them to toxic stress. And it has been demonstrated that this toxic stress has an impact on the healthy development of children. But these children grow up. We usually stay there in looking at this first part of the panel, but these children grow up, and what happens when they are adults? We understand that the poverty is not a destiny. So many of the children will do well, but it's going to be very difficult for many of them, and many of them will not be able to attain good employment and high earnings. So we see that these children that grew up in poverty will have lower earnings as adults, higher unemployment rates, poorer health outcomes, will be more likely to be victims of crimes, and they themselves, because of the poor opportunities they have, they are more likely to participate in criminal activities. And this also have repercussions for the country. For the country, this means less prosperity, lower quality of life, lower output, lower productivity. So this, the way that poverty impact on children, limiting their capacities and the human development, has a direct consequence for the economic development of Puerto Rico. We see child poverty as a problem of economic development. We estimated the cost of child poverty, and we estimated that the annual cost of child poverty is $4.4 billion, which are composed of these three components. The first component is the biggest, lost earnings, because these children, as I said before, have lower earnings and higher unemployment. That is almost $2 billion annually that is lost because of child poverty. Health costs are are higher, 1.3 billion. These numbers mean millions. Billions. $1.3 billion in health costs and $1 billion in safety and higher crime costs, for a total of $4.4 billion annually. This means 4.3% of the gross national product of Puerto Rico. 4.3% is not a trivial amount. If Puerto Rico will be growing now at 4.3% annually, our outlook of economic development would look very different. So this is a very high cost, $4.4 billion every year. The next one. We will get now to talk about.
I'm sorry, I'm sorry, I was on mute. We are now going to talk about the projections. Caridad Arroyo, as I said, who's one of the co-authors of this study, and our statistics manager is going to go over this piece. He's going to talk a little bit about how we came to these projected numbers of children who will fall into poverty and show the different projections. Go ahead, Caridad, and I apologize for that.
Thank you, Amanda. Well, good afternoon, everyone. Thank you for being here. My name is Caridad Arroyo, as Amanda mentioned, and today I'll be talking about how does the pandemic affect the poverty rates in Puerto Rico. During the last few weeks, we were focused in creating estimates of the impact of COVID-19 and the economic security of families with children, and specifically on how the poverty ratios of families and children will change. For these estimates, we consider the cash transfer, the federal cash transfer, closed industry based on the local executive order, and the workers who could possibly lost their jobs temporarily. We also consider two scenarios. One is short term and another one long term. For us, short term was defined as the next 4 months since the lockdown started. We wanted to see how dramatically the poverty rate changes as thousands of families were displaced from their jobs. And for us long term, we considered two annual scenarios, one with 4 months without employment and another one with 6 months without employment. All of this estimate we were built using the 2018 Puerto Rico Community Survey. So what's the estimated tell us? The data tell us that without any cash transfers, 43,000 children could be plunged into poverty. This means, as we see on this immediate impact of the poverty rate slide, that child poverty in Puerto Rico could be increased from 58% to 65%. And that the poverty rate in household with children that has people that works in the closed industry could be also increased from 47% to 78%. Also, this estimate tells us that with all COVID-19 help, the child poverty could decrease from 65% to 43%. This means a child poverty rate that has never been seen in Puerto Rico in the last 30 years. So this definitely tells us that with all COVID-19 help, the child poverty could really be decreased in a significantly way. But we need to remember that these aids are only temporary and definitely will show us a very decreased child poverty in the 2020 child poverty estimate. But that could definitely be thrown back to the 57, 58 trend in the 2021 trend, or could actually be even a higher child poverty rate. So that's our main concern.
All right, thank you, Caridad. And we can go a little bit more over those numbers at the end of the presentation. I know people might have some questions around this piece. I wanted now to hand it off to Brian Rosa, our policy manager, who's going to give an overview of where Puerto Rico stood in terms of the COVID-19 relief policies. And I ask those who are not talking, if you can mute it just to avoid any background noise. Thank you.
All right, thank you, Amanda, for the introduction. So first, I wanted to just frame the help that Puerto Rico got, the aid that Puerto Rico got from all of the COVID-19 response legislation. And we framed it in a way that it compares to the vulnerabilities that were presented before by Dr. Enchaute. So first, looking at the income support for individuals and workers and the local government, what we have here is a non-exhaustive list of programs to which Puerto Rico has access to due to the COVID-19 legislation. So we're looking here at all of the phase 1, 2, 3, and 3.5 packages that were included. So first, Puerto Rico got access to all of the cash transfers for individuals and families, so the $1,200 and the $500 per child. Important to note here that although legislation was passed and approved in early April, Puerto Rico only got approved to distribute and disperse this fund by mid-May. And then I believe until almost last week, we still had some folks trying to access those funds as well. So there's been some delay in that funding. So looking also at the income support for workers, Puerto Rico was eligible to receive all of the unemployment programs. So both the pandemic emergency unemployment compensation, so the additional $600 per week, and also the pandemic unemployment assistance for those who were self-employed workers. Additionally, Puerto Rico had access to all of the SBA loan programs, including the emergency injury loan program and the paycheck protection loan programs as well. Also, Puerto Rico had access to all the sick leave and family leave licenses. Additionally, Puerto Rico got a slice of the $150 billion allocation for states. So Puerto Rico got $2.24 billion as direct aid for the local government for all the COVID-19 needs. We go on to the next one. We wanted to also present all the nutrition assistance programs. Again, since we only concentrate here on programs that are directly or could directly impact children and their families, we're not including all of the elderly nutrition grants that Puerto Rico did get. So what we see here is one of the huge programs that Puerto Rico benefited from was the Emergency Food Assistance Program. We got $20.9 million from those. And also, Puerto Rico, as you might know, has a nutrition assistance program instead of the supplemental nutritional assistance program known as SNAP in the state. And this is a very important difference because this is a block grant program. So you will get a fixed amount for the fiscal year, and Puerto Rico will need to balance those funds throughout the whole fiscal year, notwithstanding any emergencies such as the earthquake and the pandemic that could move more people into getting into the program, making the funds a little bit thinner for everyone else. So Puerto Rico did get a $247 million increase in the funding for NAP. And that is similar to the 15% increase that the states got for the SNAP program. However, this funding only goes all the way until the end of this fiscal year. Lastly, we wanted to highlight that Puerto Rico has access to the additional $500 million for WIC. However, at the time for this presentation, we could not find the specific amount that would go to the WIC program in Puerto Rico. If you go on to the next one, we look at also education, and then noting that all of the higher education relief funds got delivered to Puerto Rico in a pretty fast manner. For this, it was dispersed throughout the whole higher education institutions that were participant of those grants. However, some did not necessarily took into account vulnerable college students to provide the assistance. Some of them simply got the total amount and divided it by the total enrollment and then dispersed the funding that way. Then we looked at the governor's emergency education relief fund and also the elementary and secondary school emergency relief fund. Those were allocated as well for Puerto Rico. However, the U.S. Department of Ed has yet to disperse those funds, and they've been delayed because of a need for an external agency to audit the funds appropriately. Last June 15th, so 15 days ago, the government of Puerto Rico submitted a plan for the use of those funds. So it's important to monitor how that relationship is happening. Lastly, we also got funds for the Child Care Development Block Grant. And we also got some Head Start and Early Head Start funds. In the case of the CCDB funds, those were still yet to be dispersed to all the child care providers. Up until last week, we got to see the application process online. And then in terms of the Head Start and Early Head Start programs, what you see there is a total amount allocated in the CARES Act. However, we know that Puerto Rico will get a slice of that amount, and some of the funds are available for states to apply. So the amount of the Puerto Rico will get may vary. As we go on to the next one, the Community Development and Welfare Funds. Here we see all the child welfare and services. And I wanted to highlight that both the child welfare services and the runaway and homeless youth program, the amounts you see there are, again, the total amount allocated in the legislation, and Puerto Rico will get a slice of those programs. But we did get the CDBG funds, 45.2 million of those. We got 42.1 million for the community service block grant. We also will get funds for the Community Development Fund. The PHA funds are also available for Puerto Rico are 42.7 million. We got an increase in TANF, which is of 3.4 million. And we also got 4 million for the HEAP. Family violence prevention programs, what you see there is a sum of 2 grants that Puerto Rico got. So the supplemental awards for the state domestic violence coalitions and also the other state allocations. What we did here is that we added them and we presented it here in the table. However, the total allocation for family violence prevention programs is 45 million. Puerto Rico might be able to get an additional amount as these funds may become available. An important thing here to note is the TANF increase of 3.4 million. So TANF in Puerto Rico is capped by the social services cap in the Social Security Section 1108. We will discuss further later. But what this does is it creates a limited amount of funding for the program. And we believe this is an important program as we try to move forward with the economy as we see it. As we go on to the next one, I wanted to highlight some of the programs that Puerto Rico did not get access to. So a very important program that we already know that 45 states, DC and the US Virgin Islands have access to is the pandemic EBT program. So Puerto Rico did not have access to this program, mainly because of the SNAP and NAP difference of the way those programs work. And so we saw in the HEROES Act, and we also saw conversations around it where people were suggesting a feasibility study before approving such a program like this one. But as of now, Puerto Rico does not have access to use the Child Nutrition Funds for a pandemic EBT program. As we go again, and I wanted to make sure that this is clear, since Puerto Rico does not have SNAP, what Puerto Rico got was an estimate of what could be the increase of 15% in NAP funds. But it's important to note that NAP is traditionally underfunded compared to SNAP. Estimates of around $1.2 billion annually have been suggested in ways that these programs are very different in the way the funds are distributed. So to give you a picture of how it works, you might see a family in Puerto Rico receiving an average amount of $340, a mother with 2 children. That same mother with 2 children moves to New York, for example, and she will get upwards to $500. And this is the same family, it's just they live in a different state, in a different territory. And then we also wanted to highlight 2 main things that, there's a delay in the Department of Education funding, and it's also a delay in the direct cash transfers. And those might have an impact on the way the economy responds to this pandemic. So we might need to see, we feel hopeful that the next package would include supports that could withstand the negative effects of the delayed disbursement of this funds.
Thank you, Brian. So Brian gave a good overview of, where Puerto Rico has stood, particularly programs that impact families with children and children in the midst of the COVID relief packages. So what we wanted to do is in the report around the impact of COVID on families with children and their economic security, which we will give you access to after this webinar, and you will have the links, you will see a host of recommendations there, but a lot of those recommendations will have to be implemented by the government of Puerto Rico. And so what we wanted to do today was focus more on those recommendations that were specific for the congressional audience, and especially right now as the next COVID relief packages are being considered. And then we also want to talk in the next slide about some longer term recommendations that we see as important in the general reduction of child poverty for Puerto Rico, and that we are extracting those from another study that we actually presented in a congressional briefing in DC in January on the cost of poverty, which Dr. Enchaustegui presented a little bit about that, but that came along with a blueprint. And so we also wanted to extract some of the most relevant and high-level recommendations that came from there, just to put it on your radar right now, although we know right now the focus is mostly on COVID. And so these are the 3 things that we wanted to focus on that we believe are important for mitigating the impact of COVID on children in Puerto Rico, particularly on child poverty. So as Brian mentioned, Puerto Rico did not get access to the resources for the pandemic EBT program, mostly because Puerto Rico does not have SNAP, and that's how it was enabled. There were, as most of you know, there were resources that were appropriated specifically for implementing this pandemic EBT program, and Puerto Rico currently, as the language stands, does not have access to it. This was the language in the Families First Act. So what we have been advocating for is to allow for Puerto Rico to have access to those resources, because even though technically Puerto Rico has actually already submitted a waiver, and Puerto Rico could implement the program, but it would have to take from its already limited NAP funding, which is already insufficient to fund that. And so, we definitely don't want to, like they say, rob Peter to pay Paul. And so what we are advocating for is access to these resources. The HEROES Act included language that would enable this if Puerto Rico conducts a feasibility study. We are worried that that would really slow down the process of an already urgent and delicate situation. So what we would advocate for in a Senate version would be for just access without that condition. We are concerned that even though schools may be restarting, that until the pandemic is really over, as we know, there's going to be school closures on and off, as we are predicting, correct? As other outbreaks occur, we are not really certain that this will be a stable, that, you know, children being in school will be stable. Same goes for the school cafeterias, and there has been a host of controversy around this, and you might have some questions about what is happening with the school cafeterias. Some of them are open, but some of them have already had to close because there have been outbreaks. So, you know, we believe that this pandemic EBT is the most logistically straightforward solution to the issue, and particularly having a place like Puerto Rico with such a high child poverty rate, it's critical. The second thing is the increase in NAP funding. The number that has been thrown around and that we've been advocating for right now is 1.2 billion. We believe that this would get Puerto Rico to comparable levels than the U.S., and we fully support this increase. We think it's also important for supplementing the food security needs of families. In terms of the conversion from NAP to SNAP, which is something we've been asked about, we know that this is probably not going to be up until the Farm Bill is up in 2023, and we want to do additional analysis to see what is most beneficial to Puerto Rico, whether increasing the NAP funding and keeping the flexibilities of the NAP program or going over to SNAP. Something that is really important to highlight about why this increase in NAP funding is important, and we will also send additional data on that, is the fact that when we look at the children in Puerto Rico who are living in poverty or close to poverty, so when we do the 130% poverty line, around 29% of them do not have access to NAP because the income thresholds have to be lower than in the States, particularly because the funding is limited. So when we advocate for an increase in NAP funding, or we're analyzing whether it makes sense to convert to SNAP, what we're really going for is for all the children in Puerto Rico who are living in poverty or close to poverty to have access to some form of nutritional assistance, which is not the case right now. The third piece, which has been included in the HEROES, is extending the child tax credit for families in Puerto Rico with 1 or 2 children. This is an issue that we've been bringing up for years now. We think it's valid to include it in a COVID relief package because it provides more stable income support for families, especially those lower income working families that when we look at the projections and some of the numbers that Caridad shared with us, it is particularly those families, those low income working families that were working or are working in industries that are closed, that have had the biggest impact in terms of their economic security and are the ones that have overwhelmingly been falling into poverty. So providing the child tax credit is not only advances the agenda of reducing child poverty in Puerto Rico, but provides a more permanent and stable aid to those families that goes beyond the initial burst of incentives that they're getting now that we just don't know how sustainable it is. And so we are fully supportive of that and are happy to provide as much data as you need to support this policy and why this is important. Oh, my computer today has decided to be stuck. So the next slide, whenever it decides to come up, is around the longer term policy recommendations that we have. This is not exhaustive. We just wanted to put and mention a few to have on your radar. The first one is around, Brian mentioned the Social Securities Act, Section 1108, which places a cap on social services in Puerto Rico, including TANF, actually Title 4E, which is child welfare funding, and a few other social programs. So one of the things that we want to begin exploring is to what extent this cap can be lifted for Puerto Rico, because we do believe that really limits what we can do with TANF, which is intended to be one of the main programs to lift mothers with children out of poverty, which is the main profile of families living in poverty. The second one, although it's not coming up, but I know them all, the second one is around child care funding. Puerto Rico right now does not have access to all the federal child care funding. We have access to the child care discretionary funding, so, but we do not have access to the child care, the mandatory funding and the matching funding. And so, you know, that also limits the extent to which Puerto Rico can have a robust child care system for low income workers and those living in poverty that are wishing to enter the workforce. So that is a big component of our blueprint when we're looking at the blueprint of reducing child poverty in Puerto Rico, is strengthening the child care and early childhood systems. And, you know, without having that full and equal access to these funds, that will be a little difficult. And the last thing that my PowerPoint never cooperated here with is to include Puerto Rico, and this is more of a broader theme, but as some of you may know, over a year ago, the National Academy of Sciences released a report on reducing child poverty in the United States over a 10-year span, and Puerto Rico was not included in that report. It has a host of recommendations that would have child poverty, right, in the United States over 10 years. That was one of the reasons why we decided to take on this blueprint and this cost of poverty study that we presented in January and that we highlighted here. Because given how serious the child poverty situation is, how integral that is to the Puerto Rico's economic development, we think that we also need a blueprint. And what we advocate for is that as the conversations around the reduction of child poverty continue to take place in Congress over the next year, 2 years, whenever it is, to always include Puerto Rico in those conversations, because Puerto Rico is the jurisdiction with the highest child poverty rate. And so any legislation, I know that there have been proposals and bills to strengthen the child tax credit, to have some sort of child care stipends. There's all sorts of proposals that are part of this broader blueprint that was charted by that report, and other proposals that other advocacy organizations have been pushing for. But it's important that whatever is done around child poverty includes Puerto Rico. So those are more of the longer term recommendations that we wanted to put on your radar. We are always available to delve a little bit more into all these findings, and we're actually going to have a space now for questions and answers. The other thing that we will do after we're done with the questions and answers, if my computer allows it, will be to just give you some resources, which Caridad, our data manager, will do, that you can find on our webpage that might help you find other data that might be relevant as you craft policy related to Puerto Rico and Puerto Rico's children. So I'll open it now for questions, and as I'm doing this, I'm going to take the presentation now to see if I can put it back up so you can see the resources. Atavera, do we have any questions in the question and answer session?
No, we don't have any here in Q&A yet.
Okay, so maybe we're super clear. Okay, let me then go into the resources section. I am having some difficulties with this presentation. I'm not quite sure what's going on. These things always happen. But let me see if now it is resolved. Okay, I think, okay. All right, so Caridad, if you want to go ahead and give a little bit of this overview of other resources that we have available to you in our website, which I think is a great tool for congressional staff.
Yes, of course. So as Amanda mentioned, we wanted to make a quick presentation of multiple data products that we have available at our website that has data for Puerto Rico, DC, and the state that will be useful for you whenever if you need children's data or if you're writing about child poverty or Puerto Rico problems. If you can see that our main menu has been it's very simple it's easily to use for the user. So if you're looking for data, research, public policy, or anything other else, you can find it on our main menu. So can we go to the next one? Yeah, perfect. So we're gonna focus in the data and our library section. So the main products that I wanted to talk to you are our main data products that are the Children and Youth Wellbeing Index and the Kids Count Data Center. Some of the fact sheets that we have where we approach the child poverty problem in Puerto Rico, and our library where you can find all our publications published in the section of our website. So as you can see at the data tab, you can find the Child and Youth Wellbeing Index in our website. I wanted to talk to you a little bit more about this. So what is this? What is this product? This is basically a radiography to help visualize the living condition of children and youth in Puerto Rico. This index contains 27 indicators in 5 dimensions, including economic, education, family, health, and safety. And it helps compare Puerto Rico, DC, and the states. It helps to make a comparison within them. So basically, the main sources of information of this product are composed by these multiple agencies. Can we go to the next slide? Yeah, sorry. So the main data sources of this index is the Nation Report Card, the CDC, and all the agencies that we see here. Let's go to the next one. So the main results of this data product tell us that Puerto Rico has the highest. Let's go to the previous one. Yeah, thank you. So the main results of this product tell us that Puerto Rico has the higher percentage of children living in Puerto Rico with 58%. This is almost double than New Mexico that has the highest one. Also, that is very interesting to consider is that even though the total population of Puerto Rico ranks 99th in comparison with the rest of the states, the total children living in poverty in Puerto Rico ranks 11th in comparison with the 50 states in DC. So this definitely tells us a huge disparity in terms of the proportion of the population that lives in poverty in Puerto Rico in comparison with the states. And also this product tells us that Puerto Rico presents the worst condition in all 4 economic indicators that we see in this product. The next main product is the Kids Count Data Center. We are the ambassador of the Kids Count the Kids Count project in Puerto Rico, so we get to update all this database where you can find also data from all Puerto Rico states and the DC. This is a very convenient platform because it has a tool that is ready available for you to make maps, line graphs, bar graphs. So it could be really convenient for you if you're in a hurry. So this is basically how it looks, the website, and you can see Puerto Rico right at the bottom of the screen. Here's an example of some of the graphs that you can do. It's very user friendly. You just need to make a couple of clicks and you'll be ready to go. Another example of one of the products that I wanted to show you is the fact sheet. This is an example of one of them. This is the profile of children living in Puerto Rico. This was basically the profile that told us that the internet gap in our children in poverty. This product establishes a direct comparison between children living in poverty and those who live above the poverty level. So it's a very useful product to help identify the disparities. Some of you can see enlisted in here, some of the indicators that could be found in this product. And one of the main results that I would like to highlight, if you can go to the next slide, Amanda, or to click to the next bullet, is the huge disparity that we can see in the youth 16 to 20 that is not enrolled in school and is not active of the workforce. We can see the 16.5% of those who live in poverty in comparison to a little bit less than 10% of those who live above the poverty. So we see that poverty is actually a huge indicator making an impact in this youth population. Next slide, please. And the last one is our library. This is just a snapshot of all the things that you can find in here, all the products, the Kids Town profiles, and all the publications that we constantly communicate with all of you. So the next slide is, these are all the websites that you can find all our data products and social media if you want to follow us. Thank you.
Thank you, Caridad. I want to thank everyone who showed up today. We are available to answer any questions you might have, any data that you might need, that you might be looking for. And we always want to make ourselves available as a partner in your thought process about Puerto Rico, particularly children and youth. And if we can't answer the question, we're always happy to connect you to people who can on the ground. So thank you. We will be sending a follow-up email also with the recording. And we look forward to seeing you in DC once the pandemic is over, and perhaps in another webinar. I think, are there any questions? Because I did see.
No, it's just a thank you message
Okay.
from Amy Ortega. Thank you, Amy.
Okay. Okay, thank you. All right, well, thank you so much and have a good one.